Well, statistics show that as of 2010, about 6.8 million Americans aged 20 and up suffered a stroke. It is something that can happen regardless of age. My guest today is husband and wife Matthew and Angela Landry to share their personal health experience with stroke, along with Dr. Sheryl Martin-Schild, director of the renowned stroke program at Tulane Medical Center. Thank you for joining me today.
Thank you for having us.
Now, Mr. and Ms. Landry, share your story with us. Tell us what happened, and when did you first notice any symptoms of stroke?
It was actually recently. It was March 10th. I was laying in bed with my two youngest kids. Got up in the middle of the night to go to the restroom. When I went to get up, I had a sharp pain in my right side of my head. Left side of my body went numb, and I hit the floor. I could not get up. I couldn't move my left side. My kids started crying. My wife comes in the room. As soon as she asked me what was going on, when I went to respond, she knew right away something was wrong because I was slurring and my face was sagging on the left side. So she called 911.
Now, Mrs. Landry, he said that you responded right away and what you saw. Can you give us a little more detail as to how you responded in that situation?
Yes, when I walked in the room, I found him lying on the floor, and when I asked him what was going on, he just said that he had a sharp pain in the side of his head, and that he thinks he fell and hit his head, so he wasn't really sure what was going on. And as he was speaking to me, I noticed his slurred speech, and I just always remember hearing about having stroke and being older, a lot older, and so not at the age of 40, I didn't think we would be dealing with him having a stroke, but the symptoms, the slurred speech, and his left side was immobile, and I knew at that point he needed some medical attention, so I hurried and dialed 911 and got him to the hospital.
Now, also share with us, how has your life changed since that time?
It has changed in so many ways. We have a much bigger outlook on our health and trying to get everybody in our family on board and taking care of ourselves. And we have 3 young boys, and they've been a big part of helping take care of him and his recovery. And he's doing a wonderful job in 8 weeks.
I also have a better appreciation of disabled people. I didn't realize how much I used my left side, how much I needed it. So now, when it comes to disabled people, I have a lot more respect for them.
Well, we're so glad to hear that you're doing better, and thank you for sharing your personal story with us. Now, Doctor, can you share with us the do's and don'ts when faced with a situation like Matthew and Angela's?
Thank you for asking. The most important thing is to recognize symptoms and signs of stroke and then to respond. So in terms of recognition, I recommend that you learn the acronym FAST. Face, arm, speech, time. She didn't even realize that she was using that acronym, but she recognized that her husband's face wasn't moving properly on one side. She recognized that his arm was not moving properly. She recognized that his speech was not coming out sounding normally. And then she went immediately into action by dialing 911, which gave him the best chance of getting time-sensitive treatment that greatly improved his outcome. And that's the most important thing to do.
Absolutely. Now, I mentioned about the statistics about Americans ages 20 and up who have suffered a stroke. It's rather surprising. Can you give us a little more insight on that?
Every 40 seconds, someone has a stroke in our country, and every 4 minutes, somebody will die from stroke. It is the 5th leading cause of death in the United States, but it is the #1 cause of new onset adult disability. And stroke does not discriminate based on age, based on gender, or based on race. Anyone can have a stroke, and so you need to be on guard. If you recognize that somebody has a sudden change in their ability to function, whether it's vision or speech or strength or sensation or ability to walk, or they're complaining of a severe new headache, those are reasons to suspect stroke and to do the right thing. Call 911, give them the best chance. When 2 million brain cells are dying every single minute during a stroke, you want emergency care, and the best way to get that care is to dial 911.
Absolutely. Now, what advice would the 3 of you give to other families who may be worried that they may find themselves in this situation and may panic and not remember those steps. What advice would you like to give to them?
When in doubt, if you have any doubt at all, you know something's wrong, just dial 911. I mean, don't take a chance.
Be safe.
You only get one chance to get it right in the setting of stroke. Once brain cells are destroyed, you can't get them back. With rehab services, you can improve your function. Like Matt has improved greatly. But the most important thing is to get that care immediately, not take any chance. Like Matt said, if you have any sudden loss of function, assume it's a stroke and call 911. You shouldn't be afraid of calling 911. You should be afraid of living with long-term major disability.
Yes, absolutely. Now, you mentioned rehab, Doctor. What advice would you give to family members to support one of their loved ones who has had a stroke?
It can be very stressful dealing with new disability and your loved one. Learning how to adapt in some ways and learning how to support and encourage in other ways can be difficult. I'm sure Angela can attest to that. Sometimes you don't know whether you're pushing too hard or not pushing hard enough, but having access to aggressive therapy services is incredibly important.
And Angela, would you like to add to that as well, since you're dealing with it firsthand? What advice would you give to other families?
Exactly what you said. Just being there support, being there when they need you, and staying positive.
Absolutely. Thank you so much for joining me today to share your story. And lastly, Doctor, where can people go to learn more information?
There's lots of information available on the internet, but I would recommend starting with www.stroke.org.
Thank you. And for more information on stroke as well as other tips and resources, visit www.stroke.org. Thank you so much for joining me today. It's been a pleasure, and I wish you the best of luck, Mr. and Ms. Landry, on your continued recovery, Matthew.
Thank you. The pleasure was mine.
Thank you.